All right, folks. Hopefully I've got this right. Give me just a second. There we go. Okay, folks, real quickly, sorry for that little technical glitch. This is my third take because I am very technologically challenged. I wanted to take a moment to update our office kind of information for everybody who's clamoring to get the COVID vaccine for their children. And again, I want to preface this by saying this presentation is designed just for folks who have chosen to use South Riding and Farrell Pediatrics for their primary care. I understand sometimes these videos can get out there, and honestly, if you don't know us and you don't have the trust in us, this really isn't designed for you. So first thing I want to address, it's October 28th. I'm actually recording this one day after making the slides. It's now October 29th. I'm at the end of a long day of work, but I really feel like we need to get the word out. We're receiving a lot of calls and questions, and I hope this is helpful. This talk is designed in 3 parts. The first part is just about the nuts and bolts of getting the vaccine. So if what you are interested in is how do I get this vaccine into my child as soon as possible, I will deal with that in the first 5 minutes. And then I have about 25 minutes of talking about some of the science, some of the data, and some facts and myths. So essentially 3 parts, nuts and bolts, science and data, and then kind of myths and facts that we can discuss. So you guys are welcome to sign off once you've heard what you need to hear. I'll start off with the vaccine nuts and bolts. So 12 and up can receive the vaccine at our South Riding office or the Dulles Town Center Vaccination Center. My advice is if you are of that age range and we're waiting, please go now. We anticipate full vaccine approval this week. The CDC and the ACIP must follow through after the FDA has granted emergency use authorization. I want everyone to be, this is what I need to get across for those of you who are anxiously awaiting this vaccine for your children. The vaccine is distributed by the state to individual health departments who will start immediately scheduling at their community vaccine centers. So these community vaccine centers, there will be at least 9 of them set off along the state of Virginia. And once those appointments have been made and the vaccine that they have is accounted for, they will then distribute the vaccine to our private offices such as ours, and we will get vaccine distribution. So we anticipate that most of our families will get the vaccine at these community vaccine centers. And so in Loudoun County, that's at the Dulles Town Center Mall, where the reputation of the nurses and the staff there is beyond reproach. They have been amazing. And I know Fairfax County will likely have 2. I'm not sure of their exact locations, but I know one's in Tysons. These are the links to sign up. You cannot sign up until they get the vaccine in their fridge. It is a different vaccine, different dose, different vial. So for the 5 to 11-year-olds, what we encourage you guys to do, if you're urgently awaiting vaccinating your child, we encourage you to sign up for the health department alerts and check their website. They're doing a great job of communicating when they're going to be getting it. Please do not call our front desk at this time. We do not have the vaccine for the 5 to 12-year-olds due to this trickle-down logistics, and it may be a month or so until we do receive it. We are looking for alternative ways to obtain the vaccine, and those pathways may be open to us, but we are also struggling with some staffing issues, or demand issues is a better way to discuss it, as our nursing and physician and front desk staff are providing care for the community via testing as demanded by the schools and daycares. So that's the nuts and bolts. I only want to state early in this talk, and I will restate this at the very end, that all 12 of our physicians have been vaccinated, and every single child who is a child of a pediatrician in our practice that is eligible for the vaccine has been vaccinated. At least one of our families, or the mother who is also a pediatrician, has their kids in the trial for the 5 to 11-year-old, and the others have scrambled to try to get their kids in it. So when we are asked what we would do for our own children, it is unequivocal, 100% we would vaccinate. So again, nuts and bolts, if this is what you wanted to know, please feel free to sign off. I want to jump into a little bit about some of the science and some of the statistics in our area and why we feel so strongly. So why should children get the COVID vaccine? Unfortunately, children do get COVID-19, and some do get critically ill, and there have been mortality. 5,217 cases of multi-system inflammatory condition, which is an arteritis, a little bit similar to Kawasaki's disease, which can be very serious and cause arrhythmias. It can cause, unfortunately, mortality. And these vaccines are highly effective at preventing these complications, including hospitalization and including death. The vaccines do reduce transmission, as opposed to something you may have heard from an ESPN reporter. So please try to get your information from us, not sports reporters, because this does reduce transmission of the virus, although some transmission can occur. So again, very, very helpful in those settings. And of course, over the time since schools have opened, the highest rate of COVID-19 infection in Fairfax County are in children ages 5 to 9. And I want to pause here and I want to say some of my statistics are coming from Fairfax, some from Loudoun. I need to thank Diane Dubinsky, who's the physician who put these slides together for our Virginia pediatric chapter. She's wonderful, and she has given me permission to use these. I also have communications from the health departments of Fairfax and Loudoun to give you some of these statistics. Again, these vaccines will help keep children in school by reducing infections. So many of you have been already affected by quarantining your child. There have been hundreds of thousands of missed hours of education due to quarantine rules and restrictions. Once you are 2 weeks from your second vaccine, if your child remains asymptomatic, they no longer need to quarantine. And I think we saw last year what missed school time did. It obviously had a major effect on the quality of education, and it also had a major effect on mental health issues for our kids. So again, reiterating how important our school administrators and our teachers are. And so again, anything we can do to keep our children in school and healthy is an absolute necessity for our community and for your kids' health. The vaccines offer protection against some of our variants. So the Delta variant, the most latest of probably 3 and more to come, still showing activity against this at preventing hospitalization and death. And again, we need to maximize the proportion of people, including children in the US, who are fully vaccinated. And that is critical to ending this pandemic. So again, until we get 70% of the world vaccinated, there will be new variations of this disease. And it may be the next Greek letter alphabet that's up next, mu or lambda or theta. But whatever it is, we expect these vaccines to continue to show efficacy against them. But unfortunately, if we take our time, there may be a variant that can defeat our vaccines. So hence the speed with which we are trying to do. There's a goal to reach full vaccination of the world by the mid-2022. Again, that would be wonderful if it happens, but it has to start here with us in our own community. And so again, vaccinated children will help protect the elderly and high-risk household members and visitors, especially during family gatherings, which are coming up, and the holidays. And again, just a personal, my college commencement speaker was General Colin Powell, and unfortunately he passed away this week. And he had multiple myeloma. He had which causes a suppressed immune system. And despite the fact that he was vaccinated, he contracted the disease, and the complications of COVID left to his passing. And there's a great American hero whose death could have been prevented by vaccination of those and those around him in many cases. So here's a little statistic about basically that wedge. That blue wedge represents children 0 to 11. So vaccinating that percentage of kids will make a big difference in reducing the number of human beings who can obtain this virus, where it can grow within them, where it can possibly change into a variation and also infect others. So it's a very large part of our population, so it should not be ignored. A little bit of data, current US COVID-19 data as of October, early October, 6 million cases, and 16% of those were children. That increased to 24% since Delta. The hospitalization rates, 0.1 to 2% of all child cases. And again, this is one of those things where that is not an insignificant number of kids being hospitalized. You can see that in our children's hospital and ICUs. And thanks to the dedication and incredible expertise of our pediatric nurses and doctors staffing those ICUs, the number of deaths is very low. And compared to other pandemics, this has been amazingly gentle in a way on our children, but that does not mean zero risk. So it's really flabbergasting to see people fighting against the trauma of masks when that far is outweighed by the trauma of being hospitalized. So keep that in mind as we make these decisions. Vaccine data, we're looking at 65% of the US population have had at least one dose. We're at 80% in Loudoun County, and I believe 82 in Fairfax. And we're at 88% million, we've got 11 million children under 18. And in Loudoun County, we have 88% of our kids 18 to 12 that are fully vaccinated. So kudos to Loudoun County. And thank you, Dr. Goodfriend, for those statistics. And 13 million children have received at least one dose in that under 18 range. So we have a large number of people and even adolescents that have received the vaccine. One of the policies of public health that I think we need to discuss is something called the hammer and the dance. And so the hammer is what we do to try and mitigate disease. And that is everything that we've been living for the last year and a half that honestly, we're all tired of. That is the masking, that is the distancing, that is avoidance of crowds, and that is all the non-pharmaceutical things that we do to reduce disease. And then as the disease burden lessens, the public health policies drop away, and that's the dance. And so obviously our goal is to dance again and to dance as a population. And here's the data from the last year. You can see back in June and July, personally, I even attended a wedding that I never thought I'd go to. And yes, I danced, not only, figuratively, but actually. And it was enjoyable. It was lovely to think that maybe we were at the end. But then, of course, Delta comes and you see we had to bring the hammer back out, and we have our children masked again, and we have to use our vaccines to reduce this. And honestly, that is the end of this pandemic. That is the way we get out of it. So if we all want to dance, we all get vaccinated. And so we can see, thankfully, that these numbers are coming down just like they did last year. There was a lull, but we've got the holidays coming up. And that is, again, terrifying with the combination of holidays and kids in school this year. And so we're hoping by getting this vaccine done as quickly as possible, we can really mitigate a second, or what this may be, the sixth bump, or the sixth wave of COVID coming to our shores. Again, a couple of data. On the left is data from Virginia. On the right is data from Fairfax County, so closer to us. And you can see the number of cases by age group. So these last two lines on the left are your children and then adolescents. You can see the number of hospitalizations in Virginia, not an insignificant amount, over 1,000 children in our state. And unfortunately, we've had some deaths in Virginia. In Fairfax County, you can see that kids under the age of 19 account for 19% of our total cases, 3% of hospitalizations. And unfortunately, there has been a single death in Fairfax County. To date, thankfully, there have been 0 deaths in children under 18 in Loudoun County. This graph is representative of just cases. This is not hospitalizations or death. And I think this is just so powerful of a way to show you how well this vaccine works. And let me be clear, this vaccine is designed to stop you from being hospitalized or dying. It is not designed to stop the common cold. That assertion or that expectation from some people in the media that it stops you from getting a runny nose is in many ways ludicrous, because that's not what it was designed for. So if you look at this, that yellow curve right there is the number of people who had cases, unvaccinated, partially vaccinated versus fully vaccinated. So yes, the quote breakthrough unquote is people getting a runny nose. It is not people being hospitalized or dying, because that is coming from that spike in the yellow that you see there. The people who are still filling up our hospitals and unfortunately still dying are those that are unvaccinated. The ones that show a small percentage of cases, those are colds. And so that is beyond belief effective, and more than we as physicians ever expected of this vaccine. So it's wonderful. And going a little bit deeper, how do these things work? I think a lot of you guys have seen this before, but I just, as a physician and a bit of a former genetics nerd from my college years, the artistry behind the science of this is absolutely spine tingling. So the scientists, who I have ultimate respect for, have basically produced the blueprint for just the spike of that virus, which you can see represented in red on the picture there. That is the way this virus gets into our bodies. The spike does not cause an infection. The spike does not cause illness. The spike allows entrance. So we are giving the blueprint into the deltoid muscle, into your shoulder. Your muscle cells are taking it up. Your white blood cells recognize it as foreign. They make antibodies against just the spike, and that prevents entrance into your pulmonary tissues. So 2 weeks after your second dose, you are protected. There is no live virus here. This vaccine cannot cause disease or illness. So it's quite remarkable in the way that it works. So again, biologically incredibly complex to produce, but my goodness, just artistically simple in the way it produces an immune response. So how do we know it's safe for kids? So we know that clinical trials for both adults and teenagers 12 and up involve tens of thousands of volunteers. Those are your phase 3 trials. We have over 11 million children between 12 and 17 fully immunized, as the previous slide has shown, and the side effects are incredibly mild, and there are some common ones. Serious adverse events are rare, and studies have also shown that it is incredibly safe during pregnancy and breastfeeding and provides protection for the newborn infant, which obviously as pediatricians we get quite excited about. So the most recent data on the Pfizer-BioNTech COVID-19 vaccine, we just had EUA authorization followed by the FDA. So the FDA has millions of dollars and incredibly intelligent people looking to say, is this safe? And they answered to us on the 26th that it is safe for this population. We now need the CDC and the ACIP to weigh in to give approval for its administration. There were 2,268 children in this study, some of them possibly children of pediatricians in our practice, and they were given a lower dose. So this is important to know. This dose is based on your immune system maturity. It has nothing to do with your size. So if you are 11 years old and very large, you still get the low dose. A petite 12-year-old still gets the adult dose because puberty causes some changes to your immune system. And we saw with the young immune system, these children got an immensely high immune response. Many of their numbers were higher than adults who got the higher dose. So again, kudos to the child immune system and maybe one of those protections as to why they don't always get as sick. And we're seeing the same side effects in older children. And again, no serious events in the 2,268 that were part of this study. So side effects, I think most of you are familiar with. The biggest one for myself was tiredness and a mild headache, again, alleviated by rest and some ibuprofen. Lasts about 24 to 48 hours in most cases. One of the more concerning side effects in any medication is anaphylaxis. And so this can happen with any single medication can cause this. And this is the difficulty breathing, swelling of your face and throat, rapid heartbeat, and hives. This occurs at an incredibly small amount with this particular medication. 5 cases out of 1 million doses in people over 12 with this vaccine. And a lot of that goes back to that simplicity that I was talking about. There are very few ingredients to this vaccine. This is more common if you have a prior history of allergy of one of those components. Adult women, no increased risk in children versus adults, but most importantly, that bottom sign there, it is not related to environmental, food, bee sting, or other common allergens. So if you have a child who's got a peanut allergy and that makes you with heightened anxiety about everything, which my own son had, and I understand completely, then you don't need to be scared of this vaccine. Nothing about your child's previous history of food allergies pertains to this vaccine. So it's certainly okay to go forward with that. Myocarditis. Myocarditis is an inflammation of the heart tissue. It presents with chest pain, shortness of breath, and what would be most concerning, an arrhythmia, which is a rapid fluttering of the heart with the inability to pump blood effectively. This occurs after many different viruses. So almost every single cold that you have ever had in your life had the potential to cause myocarditis. Thankfully, with most viruses, that incidence is very low. We are finding to be surprisingly high with natural infection with COVID virus and incredibly small numbers of patients after the mRNA vaccine. So the virus itself, in Ohio State football players who tested positive for COVID and were monitored for myocarditis, 2.5% of them had myocarditis after getting the disease, whereas we saw 0.03% of teenage, mainly boys, in the week after the second dose had myocarditis. The myocarditis was much milder in the children who had it after vaccine. It lasted generally a day or two, and it was alleviated by ibuprofen. So again, this is an incredibly rare complication, and it happens at a much lower rate than the disease. And unfortunately, folks, what's going to happen is as we get more and more of our population vaccinated, we're going to start dancing. We're going to start taking away these mitigation factors that have protected all of us in many ways. And those patients who are unvaccinated pretty much will be getting this disease. It will become endemic, meaning it will always be there. And if you don't have the vaccine, you're going to get the disease. And the risk of myocarditis with the disease is far higher than the risk after the vaccine. The other thing that I'm telling parents of teenage boys is you can schedule this thing. So you schedule it, and the week after the second dose, I have them restrict cardio. Now, I'm making this up. This is not coming from anyone, but it's more common sense. If we know this happens in the week after the second dose, and it takes an elevated heart rate of 160 beats per minute for a long period of time to have an arrhythmia, just don't do heavy cardio in the week after the second dose. So I'm not having my patients run a marathon or go for a triathlon in the week after that second dose. And again, most cases completely recover in a short period of time. Okay, and I think we answered a little bit of this, but I wanted to talk about who should delay getting the vaccine because we get this question a lot. So people who actually have COVID should delay vaccine only until their isolation period is over. They do not need to wait a certain number of days. It is not 3 months. It's basically once their isolation is over, they are eligible for the vaccine. Also, if you had a known exposure, you should delay until that quarantine time has ended. Oops, sorry about that. And then people who have received the monoclonal antibodies. Now, this does not pertain to kids. This is something given to adults and high-risk older patients. And that is something that should delay you for about 90 days. But again, for most of you listening to this, that is not pertinent. If you have other illnesses, then you're going to have to talk to your own trusted physicians. And so for your children, hopefully that is us. But for children, for example, who have diabetes or moderate asthma, they are first on my list for patients who should receive this vaccine. So again, feel free to call if you have a child with a chronic illness. Again, we talked about everyone in these age groups, with the exception of people who've known to have allergic reactions or a history of myocarditis after this vaccine or previous vaccines. Again, when we talked about it, distribution expected in a few weeks, and the vaccines will be available at multiple locations, but mainly we're looking at those community vaccination centers. So we expect speed and efficiency from them, and the potential ability, just to go into these community vaccination centers, the potential ability to get every single child in Loudoun County vaccinated within 2 to 3 weeks, because they were seeing 4,000 patients a day. And we have approximately 30,000 kids in Loudoun County. It's by my estimates, just knowing our school enrollment and doing some very, very non-accurate mathematics. But we could get this done in 2 weeks if we really, really got those community vaccination centers up and running. Okay, last part of the talk, we're getting there, facts versus myths. So I want to deal with some of these because we get these questions a lot. I've heard that the vaccine was made too fast. I think what I want to stress here is just because something is new to you doesn't mean that it's new. So I think I used the example of, I'm sure there's something going on in aeronautical engineering that I've never heard of, and when it comes out, it'll blow my mind. But just because it's not my area of expertise doesn't mean that it's new. So the technology goes back to 1987, and mRNA has been under investigation since, or vaccines since 1961. So we're talking about decades of research into these types of vaccines. As a pediatrician, we have heard about this for a long time because one of our most hated diseases is respiratory syncytial virus, which causes multiple hospitalizations and is going on right now in our community. And we have been hoping and praying for an mRNA vaccine against RSV. We're also looking for an mRNA vaccine against influenza that will be more effective and perhaps have a much longer lifetime than needed to get an annual shot. So what simply happened here is the government took out, one, financial risk, but two, more importantly, the red tape that has slowed down almost everything that the government touches. And again, the infection rates were so high, it was easy to get a number of people enrolled in these studies. So phase 1, phase 2, and phase 3 trials have to occur with all medications that are ever administered All those phases were done and completed, and they were not rushed. It's just the time between phase 1 to phase 2 took months to years in the past. That was eliminated. So as soon as we saw the data and it was approved and evaluated, we moved right to phase 2 and then right to phase 3. So there were no safety steps skipped. And the funny thing is, I think this is a big argument in other areas. Those of us who live closer to DC understand how incredibly slow the government can be. Anybody that works with the government, they look at this and they go, yeah, that makes sense. So again, the vaccine can alter my DNA. So basic biology, the DNA is in the nucleus of the cell. It is the boss. The mRNA is the worker. It cannot come into the nucleus. There are security systems in place so that mRNA can never enter the nucleus. It stays out in the cytoplasm, which is the outer part of the cell. And there is absolutely no way you can alter the DNA within your system. So imagine the science that, if it could, that would be taking place. So this is absolutely biologically inaccurate and cannot be done. And the myth, I can get the COVID infection from the vaccine, and we know that the vaccine does not contain the virus. There are other vaccines that do this. So this is one of those arguments from from people who are not pro-vaccine, and that the oral polio virus, for example, could give a susceptible person the virus or someone in contact. This has absolutely no correlation with this particular vaccine, so you cannot get it from the vaccine. And again, some of these assertions are just beyond belief for those of us with any medical knowledge that they're taking off and they're growing legs. If you look back at the original polio vaccine, there's an old cartoon of a person growing a cow from their arm, where they got the vaccine because it was obtained or it was tested in milkmaids who were milking the cow and getting it from the pox from them. And so we all look at that and laugh, but a lot of these arguments aren't that much farther away from growing a cow from your arm. The vaccine can affect fertility. We need to talk about this one. This one also grew legs. So two very intelligent sounding British scientists claimed that the protein that is on a woman's placenta is similar to the protein of the spike on coronavirus, and that if you were vaccinated and developed antibodies against spike, it could cause placental inflammation. I'm going to quote one of my heroes, Dr. Paul Offit, who is an infectious disease doctor at Children's Hospital of Philadelphia, that basically these two proteins are similar, just like if your social security number and my social security number shared one digit, that's about as similar as these are. So, but once this occurred, we had to disprove it. So there have been multiple studies done since the onset of this vaccine, looking at women who were pregnant and received the vaccine, or people intending to get pregnant. And actually, those who are vaccinated are more likely to carry to delivery a healthy child. So absolutely been disproven. So I hear this from parents of teenagers and teenage girls quite a bit. There's absolutely no effect on fertility. Here's a good one. If you've had the COVID-19 natural disease, I don't need the vaccine. So two sides of your immune system, your B cells and your T cells. Your B cells, again, simplistically, and that's the way I think, are your quick response, kind of the United States Marine Corps, get in, establish a beachhead, attack. Your T cells basically represent every other branch of your immune system. That would be your US Navy, your Air Force, the Army, and your Special Forces. And so when you get natural disease, or you get a single dose of these vaccines, your B cells are activated, but unfortunately, we're not seeing a T cell response. So we need a vaccine after natural disease to get that response, and we need that second vaccine for those of you who have not had natural disease. So that's why we say on the statement, receiving the vaccine after infection boosts your antibody levels and gives you cross-protective antibodies. It's much better to get the natural infection and get natural immunity. I think that's the same argument right here. The issue I have here is that as a physician who spent the last 25 years battling viruses, you get to know them. They have certain personalities and certain ways they react, and you have to know both the common ways they react and the uncommon ways. And it's the uncommon ways that really concern us. And this virus has more uncommon symptoms than any other virus that I feel like I've ever been involved with, whether it be the myocarditis, the arteritis, or the blood clots, or we need to fear this virus so much more than people are seemingly to be in fear of this vaccine. So no, it is not better to get the infection. There's no indication for COVID parties. The vaccine doesn't work. This is, again, looking at the real intention of this vaccine, which is not to stop the common cold. This vaccine is intended to stop you from being hospitalized and to die. It's really, we wanted to convert coronavirus into the common cold. So when you're, again, hearing breakthrough infections, those breakthroughs are people going from getting a cold, getting some mild symptoms of the disease. So this vaccine is highly effective at prevention of severe disease and hospitalization. It does reduce the risk of infection, and it reduces the transmission risks of Delta by about 70%. So you're potentially interrupting 7 pathways of infectiousness within a community. So instead of 10 people getting infected, 3 people might get infected from a person who's been vaccinated. So you can really reduce these chains, and the contact tracing that needs to go on, we may be able to eliminate. Again, children don't get severely sick with COVID-19, so they don't need the vaccine. This one, honestly, it makes me angry. So childhood infections have obviously increased since the summer of 2021. Last year, we sequestered children in many areas without sending them to school. While most children do have mild disease, we as a society have to ask ourselves, how much are we going to allow children to suffer? And so for perspective, every year we have between 100 and 200 deaths from influenza. Thus far, we have over 700 deaths from coronavirus or COVID-19 in children. And I'm sorry, when it's preventable, my answer is 0. There is just, you're not going to have 0 risk of disease, but you can make this so incredibly rare that there's 0 risk of death. And so 700 is just far too high. And that's, you multiply the number of years of life when you lose a 10-year-old compared to a 70-year-old, the number of years of lost life is absolutely immense. And it's, in my opinion, unacceptable. So it does happen. And my job and our job as your child's physician is to make sure that your child is not that one. And so, of course, we're going to recommend this vaccine because of the statement above that it does work against severe disease and hospitalization. And then you have to look at the vulnerable populations. There are children with immunosuppression, children who are receiving chemotherapy, children who have diabetes and chronic asthma. They are all at higher risk for this disease, and we protect them by protecting everyone around them. So basically, no one's safe until everyone is safe. We don't know the long-term effects of the vaccine. Excellent question. So again, I'm going to quote deeply into my Paul Offit knowledge base. We have looked at every single vaccine that has ever been produced and given to human beings. And if there is a side effect of that vaccine, it is known within 6 weeks. So if you are a wait and see person, and I totally respect that, and that is perfectly reasonable, then you should wait 6 weeks, maybe 2 months. That's about it. We have found that, for example, with the J&J vaccine, there was a side effect that was incredibly rare. They knew that within 6 weeks. With every other vaccine ever given to human beings, which are all designed to induce an immune response, because the actual mRNA vaccine is out of your system in 72 hours. That's how long it lasts. There's not going to be long-term side effects of that. So what immune response did it induce that could then cause long-term side effects? And it's the same immune response that other vaccines produce. So 6 weeks, I think, is a reasonable time if you're on the wait and see. So if you decide that I'm going to take this holiday and not expose my kids to anybody, I'm going to bring the hammer down on my own family, and I'm going to wait, then you wait 2 months, and then in January of 2022, you should feel very safe about receiving the vaccine for your kids. So again, I think you can see that the benefits far outweigh the risks, in our opinion, as physicians. It protects you from serious illness, the hospitalizations, death. I know this sounds repetitive. Resources. On the left here, the American Academy of Pediatrics has a wonderful website, a lot of information for what you need to know. The Virginia Back to School organization, which is 20 pediatricians around the state of Virginia. I'm a member of this group, and we have made ourselves open to do PTA meetings or talk to school nurses, talk to school administrators, and talk to parents. There's great information about the vaccine here, and this is how we end this pandemic and get our kids back to school. And very finally, and just what you guys need to consider is, who do you trust? The American Academy of Pediatrics is the voice of over 70,000 pediatricians. This includes pediatric infectious disease specialists, and they have a policy statement recommending the vaccine for all children 5 to 11. But that's an amorphous group. You don't know them. You do know us. And so if you've spent time with us, if you've chosen to use us as your pediatrician, we hope that the trust you've put in us regarding everything from feeding and caring for your newborn to managing their illnesses to guiding you through puberty and the teen years engenders your trust with us in this decision. So again, to reiterate, all 12 of our physicians vaccinated, all eligible children in our practice who are the children of pediatricians have been vaccinated. And again, misinformation exists with all topics. And I have complete empathy for those of you who have heard various amounts of information. And I hope this is helpful, that you can hear it from someone that you do know, a voice and a face that you're familiar with. And again, if you're listening to this and you are not a member of our practice, you don't have that relationship with us. So I would say check your trust, check with someone you trust, but check your sources and check your trust. And I hope this is helpful. And I thank you guys for listening. So with that, I'm going to stop sharing and end it. Thank you very much.